Yeah.
So I'm just wondering when your white blood count is so high, how does it affect how you feel? Gosh, everything, how you feel, how you think, how you, uh,
Well,
I'm trying to get her to stay. Um, because you can bring it down so quickly. She's been through this before, a couple years ago. So anyway, please go on.
so yes, it's just hard to tell. If it's chronic, I mean, some people can have it high, but it will be her current white blood cells being 100. That's a lot of white blood cells in the vessels, and so it just can. It's like a jam. It's like a traffic jam. You have a lot of cars in the freeway,
Yes.
and there's limited of space. As this number continues to progress, it can cause a clog somewhere. So wherever the clog is in the heart, in the liver, in the kidney, or even the brain, anything can happen where it can basically stop the heart. If it's there because it's clogged, there's no oxygen going to the heart. It can stop the lungs. It can infarct or give no perfusion to the liver. It can cause a stroke. All of this is a possibility that can happen. And with her high level, since right now it's called chronic myelocytic leukemia, is chronic. But if you don't control it in a very diligent way, it can advance to acute leukemia. We're actually not sure if she has acute leukemia at this time too, because the high number. So the thing is that we do need to bring it down. And if we don't bring it down, there is risk for heart attack, stroke, death. There is a possibility that it can migrate to acute leukemia, and intense chemotherapy is needed, possible transplant needed to cure. It's gonna be more harder to control than right now.
Whoa, okay. Do you have any questions? Oh, I know, Devin, you were saying that it should be easy for you to bring it down at home. What do you think about that, ma'am?
The thing is that I think we have been offering the medication Tasiga here, but Devin's not taking it. It's hard to control it without the treatment.
I have been taking it at home though.
Every day?
Yes, the new Tasigna. Why? Because I was excited that I actually got it prescribed.
Okay.
It's not the one that gets rid of the bowel obstruction. So it's not the one that helps the leukemia, ma'am.
For Tasiga, the ones that we prescribe should help with your leukemia.
What about the bowel obstruction? Is there any way would a CT scan show that?
Well, the thing is that it sounds like we are giving her treatment for something called C. diff.
Yes, yes.
So that means that they might have diarrhea.
Yeah, I know. I've had C. diff.
Therefore, there's no bowel obstruction at this time. And when we did a X-ray on the 8th, they say that there's forms still throughout, but there's no bowel obstruction. There's no bowel dilatation. So from symptoms and from the X-ray, currently there's no bowel obstruction. And
Can I talk to her for a
prevent
second?
that in the future, well, the only thing that we can recommend is good laxative every day to make sure that you're having normal bowel every day, and I think that's what we would recommend.
I think it's a social worker.
Well, just give me 1 second. So I would like to ask a question regarding what was said to me by Dr. Agrawal yesterday. He said that he was going to put me on treatments for C. diff and send me home with a medication literally for C. diff, for which he was going to prescribe me something orally and then also a antibiotic.
And that, I got a call on that. It's going to be at Vaughn's.
And then also he said that the scan that was literally done indicated that there was a lot of poop in my stomach built up. And yes, I did record this. And yes, I'm recording this conversation right now.
Yes, as I say, the X-ray does show that there is a lot of poop in there, but there's
Right. So
no
how
sign of bowel obstruction.
how would that actually show on the scan when it's for literally getting an X-ray that indicates definitely bones and potentially also bone density?
I'm sorry, you're asking two questions. So you're asking why? Oh, we're still talking about bowel obstruction?
No. I'm talking about the scan that was done, which
X-ray.
right for the X-ray for which Dr. Agrawal and I were discussing the fact that he actually brought up the fact that what I have in my stomach is a lot of poop built up.
Correct.
All right. Well, however, I've been on laxatives and inducing literally pooping a lot through so much so that I'm actually literally having the watery shits where I was literally, and that was all throughout the day for the past several days. So how would the X-ray scan literally show that there's a lot of poop built up when literally I've been having so many bowel movements and inducing having bowel movements through taking laxatives and even alternative forms of laxative as well to force having a lot of bowel movements through having very watery stool and also losing a lot of inflammation weight that way as well.
So one thing I want to clarify is that this particular X-ray was done on the 8th. If you've been having a lot of bowel for the last couple of days, which is good, I mean, you've been pooping wherever
Right.
it's seen, they're out.
And then also laxatives at home as well, ma'am. I do the same thing at home.
I cannot tell you what happened at home.
Right. Well,
If you want,
what
I
I'm
can
telling
only
you
tell you that
is that
if-
all throughout, when I'm at home, I'm constantly using laxatives, and I'm constantly having watery shits in general, and I'm always literally having bowel movements of watery shit. I'm so sorry for using the a curse word, but I'm always literally having watery stools, and a lot of them.
If you want, I can just repeat another X-ray right now to compare from last time to now. I do not know what to say other than that because I can only base on your scan on the 8th. And if you have a lot of loose bowel movement, we can do a scan today and to see if there's any changes.
Well, what?
If you do have a lot of stool and yet you're still having the, if you're having a lot of bowel movement, but there's still a lot of stool in your stomach, then that means we just need to give you more laxative.
Well, what I'm trying to make a point on is the fact that when I'm at home, I'm constantly utilizing laxatives and alternative forms of laxatives to induce having watery bowel movements and literally losing a lot of inflammation weight that way, and also getting rid of all of my bowel movements that I have every single day in general. So that's been occurring since before being admitted, for which that started on the 8th. Is that correct?
The X-ray is on the 8th, yes.
Was being admitted also on the 8th?
Yes.
Yes.
Thursday.
Right. So what Dr. Agrawal literally kept making in terms of what he, or what I'm going to use is the word conclusive, but I'm not quite sure if that's accurate at all, because he just kept literally making the same point of the fact that I have a lot of poop built up in my stomach, for which I don't find that conclusive, because I'm always literally pooping in general. So at home all the time, and I was pooping literally all the time here while I was admitted as well. So the next point I would like to make is perhaps the X-ray is indicating that I do have a bowel obstruction, because you keep bringing up the same points, saying that I have built up poop in my stomach, or in the areas for which poop gets built up, and yet I do not. And I'm always able to make myself poop at home through laxatives, alternative forms of laxatives, and it was occurring also here as well during my admitted stay.
So what I want to explain to you is that from an X-ray standpoint, if you have a bowel obstruction, you have something called ileus. When you have that kind of situations, your bowel will look dilated.
I'm sorry, what was that
enlarged.
previous word that you just used?
If you have a bowel obstruction, it might call ileus, because your
What
bowel
is my
not
call
moving.
ileus?
Huh?
What is my call ileus? What is that?
I'm saying that when you look at X-ray,
Mhm.
if someone has a bowel obstruction, it's called an ileus.
Oh, an ileus?
Yes. An ileus means that your bowel is not moving as it normally to push the stool out of your colon. And when that happens, what you will see on the X-ray is that there's a lot of air, and your colon will look enlarged, dilated. And as the radiologists read your X-ray on the 8th, they say there is no bowel dilatation. So therefore, from that, we're just seeing that it's normal constipation or bowel in the colon, and it's not causing an obstruction.
Well, however, ma'am, I do not have built up poop in my in the bowel area, because I'm constantly pooping at home, constantly.
So, Ariel, I know we're going to do this in circle. I can only tell you what the radiology says and what the X-ray show. What you experience, I understand, but just because you're having bowel movement does not mean that you have eliminated everything on a daily basis.
But
that's why I'm offering.
Then are you saying that Miralax and Lactulose and other various brands of Miralax do not work?
Well, that's what I'm trying to tell you, is that what we can do is do another X-ray and compare the two. I cannot tell you what happened before you came in. I can only tell you what happened after you came in.
Okay.
And so if you want to ask, then you can just do another X-ray so we can compare. If you have been having a lot of bowel movement for the last couple of days, and the X-ray today show that there is less, then you are passing it along with the laxative that you're currently taking.
Okay, and my next point that I would like to make is X-rays literally always show definitely the bones, the rib cage, other various bones in the skeletal structure. So for it to indicate the fact that there's a built-up amount of something, That sounds to me like there is a built up amount of some sort of bowel obstruction or perhaps tumor growthage, because I do not have constipation any day at all, ever.
And what would you suggest we do?
What I am going to be doing is, since I have been discharged, I plan on purchasing the medication that literally relieves the bowel obstruction that is available online at a cost on indiamart.com, for which it melts away literally the overhanging saggy gut that looks as if one has obesity, but it is not. It's a bowel obstruction.
So you are going through this saying that you have an obstruction, but you're having this, diarrhea. And last time when Dr. Sahotra saw you back on January the 31st, there was a CT scan of the abdomen and pelvis were ordered. And if you are concerned about an obstruction, that would have helped to see too. And so if you want, we can do a CT scan. But going through assuming that you have an obstruction and not taking the medications, that are here to see if that will lower your white blood cells.
I've been taking him at home though, ma'am, and I haven't seen my what looks like obesity melt away from what I know works, which is a Tasigna that was literally prescribed to me by Dr. Sapna, and that particular Tasigna that literally Dr. Sapna of Arrowhead prescribed me. The look of that specific Tasigna and the card of the specific Tasigna is now available at indiamart.com at a very expensive cost. And I do plan on purchasing it online because the bowel obstruction medication is available online now. The medication, I don't mean to talk over you, ma'am, but the medication that I was prescribed by Dr. Amandeep, I'm not even quite sure if he, as well as other doctors, literally know that the look of the card has changed. And the medication within the capsules is different. Because the particular medication that literally gets rid of the bowel obstruction has a potent scent to it, and there's only one type of Tasigna that has that in general. None of the other types of Tasigna have it, and I've been prescribed all of them. And every type of chemotherapy tablet for chronic myelogenous leukemia, which is my diagnosis.
So, Devon, I want to point out a couple of things. One thing is that if you say you've been taking these medications before you came in, but your white blood cells when you came in was very high, 194.
Right. I've been literally experiencing contact contamination.
I let you talk? Can you let me talk?
Yes.
So, if you're taking your medication as diligent as you described, and your white blood cells show this value of 194, we gave you hydroxyurea to bring it down, and it came down when you took it. Now, what does this show is that possibly what you're taking at home is not helping you treat your white blood cell as you think you have. Second thing is that I just want to reiterate your wishes that you do not want to have a repeat x-ray or repeat CT scan right now, and you just want to go home, you want to take your medication as you wish, then that is your right.
Okay.
I'm not stopping you.
And now I would like
sure.
I would like to speak now. Does it make logical sense that if an individual has been dealing with a tooth infection for over a year and a half, that in and of itself would raise the white blood cell count, along with having, say, for example, sexual intercourse with individuals in the community?
and infections, then it would not have came down with just the hydroxyurea, and you would have signs and symptoms of an infection. And second of all, well, I do not know how to answer the second question unless the individual that you're having sexual intercourse will have some kind of infections that you want to check out. We can run a test to see if that's the case. But other than that, if there is no sign of fever and you don't have fever, you don't have any signs of like abscess, you don't have sign of any drainage, I do not know how we can assume that is an infection-related white blood cell elevation.
Well, because generally when one engages with sexual intercourse and also has a tooth decay and tooth infection that lasts for over, I believe it was over a year and a half, that really dramatically increases the WBC. As well as when the same individual has herpes as well, for which it's highly proliferative. So that in and of itself, the combination of that alone increases the WBC dramatically in general indeed. And that is what has been occurring.
But the hydroxyurea is really bringing your WBC down.
I would also like to point out that I have been prescribed antibiotics for my tooth infection, and yes, I have been taking some, but I haven't had fully the time to get around to literally attending to the antibiotics that I was prescribed because I've been dealing with so much stress in my life and trying to research and literally figure out what's been going on, what with the sexual intercourse contamination and dental tooth infection, for which I also was not able to get around to. And I have been seen by multiple doctors in multiple different locations, and this has been occurring for a while, and every single doctor knows that I've been literally dealing with those things. Tooth decay, tooth infection, and sexual intercourse. I also had a type of vaginal infection and herpes from multiple different situations. So those alone are what increases the WBC. And then when an individual has already a condition for which they haven't been able to get around to, because of the fact that the medication that literally works on, say, the bowel obstruction is now available online at a cost for which that's great. That is great, and that is wonderful. However, I haven't been able to literally get around to doing everything that's needed to literally handle the increased WBC through, say, such as infusion antibiotics, which I never got during my whole entire time here. But what I did get and what I have been getting is sodium chloride. I've been getting that, just no infusion antibiotics, no doxycycline, and nothing to handle infection through a chemotherapeutic known as antibiotics, for which that is a logical chemotherapeutic, and they are what is called antibiotics in general. Do you happen to agree?
No, I do not.
You do not happen to agree that antibiotics are a chemotherapeutic?
It is not a chemotherapy. Antibiotics are not chemotherapy.
No, a chemotherapeutic.
No, it does not attack cancer cells.
I'm so sorry?
Antibiotic does not attack cancer cells.
No, what antibiotics do is it literally attacks the infections, plural, that are occurring in the body in given locations for different various reasons, say such as herpes, also tooth decay, as well as tooth infection. A particular case that's been going on for over a year and a half, and also sexual intercourse as well as different instances of herpes
No.
from different situations.
Antibiotics.
And so what needs to be understood here is that literally increases the WBC dramatically. And also, for the past 3 days that I've been admitted, I have not received any antibiotics at all. Not at all. So when you brought up, however, that there was a decrease in WBC, what you did not know is the fact that I was taking some of my own supply of antibiotics to make it go down. And then I also took and induced literally having the shits and cleared out my blood work with what is called a pre-made drink with niacin, L-lysine, ascorbic acid, and lecithin, which cleared out my blood work, ma'am. And so what it did is something that I would like you to know about. And what that is something that, say, people take when they are literally looking to clear out their blood work because of the fact that, say, they're trying to hide having such messed up blood work from having particular products, not products, but particular, not substances neither, but particular, not drugs, but I guess I'll go with something like that. Drugs that are in the bloodstream that get cleared out with such things, say, such as detox teas, available at places like the health food stores in general, and how to literally recreate the same aqueous solution from different various products that are available online to be able to force the blood lab numbers to reflect what the patient as an individual would like them to reflect.
Devon, this is your belief. This is what you want to do with your body. I will respect.
I was taking
My
antibiotics while I was here, and you did not even know.
Okay. My question for you is
That is what
if you-
decreased
Wait,
the
let her
WBC. That is what decreased the WBC completely. I've been taking amoxicillin and different various antibiotics that I have with me.
So I want to let you know that antibiotics will treat if you have a bacterial infection.
It will treat
If
the
you-
blood
can
infection,
you-
ma'am.
Can you?
It will treat the WBC that is high, ma'am. Now, I have
Can you
not,
let me finish?
I have not taken them for a particular duration of time because I'm trying to catch liars in a particular situation, for which I have. And I have well documented, video logged my whole entire stay here. And you literally thought, let me finish. You literally thought that the decrease in WBC was from the hydroxyurea, and you also said with prior other doctors that it was also from Tasigna. That was literally said on one of these days that I have been admitted here. It was literally yesterday or the day before. And I have to say, ma'am, this is horrible treatment to a patient. And the fact that you did not know that I was taking my own supply of antibiotics, that's something side separate that does show the intellect of individuals for whom got certified in general and actually went to universities to become what is called a doctor. Are you a doctor, ma'am?
I'm a nurse practitioner.
You're a nurse practitioner?
Yes, I am.
And you're able to read blood work this well? Or this not as well, I should say unwell?
I want to go by what I see. I hear you, and I just heard that you're also concerned you might have herpes. Will you like me to test your blood for herpes?
You can if you want.
So, if you
Or
want to know
maybe
what
you
herpes
shouldn't,
is,
because to be quite frank, I've been receiving horrible phlebotomy blood draws.
So,
What I would
hear
like
you.
to do is I would like to receive, finally, infusion antibiotics that I have not gotten, and all I've been getting is sodium chloride, literally. I have had so many bags of sodium chloride, but not any infusion antibiotics at all. It's been about 5 or so bags of sodium chloride. I've been trying to keep count, and yet no infusion antibiotics, for which normally a leukemia chronic myelogenous leukemia patient gets infusion doxycycline in general. And at other locations, I have received infusion doxycycline as well as piperacillin, and I have video logged that as well, unbeknownst to you, ma'am.
So do you want to stay and let us do an infection workup, and then we can go from there?
I would like definitely to receive the antibiotic that has been prescribed, and I would like you to not cancel that.
It has been ordered already to your pharmacy.
All right.
You want to stay and get
I'm not
it here, though?
canceling it.
Okay, you're not canceling it.
But what do you want to do now? Do you want to stay and take it here, and you take the medication as prescribed, or would you like to go home and try your regimen?
You're offering for me to take my doxycycline capsules here when I get them?
No, I'm saying that is your vancomycin for your C. diff colonization. I cannot give you doxycycline without any proven of infections. So we can do a blood workup to see if you have any infections that require a antibiotic.
For which one has been prescribed, because I've been literally getting talked to by several doctors saying that I have C. diff and also a lot of built up poop that is very inaccurate, and there is a lot of lying.
So for C. diff, it's called vancomycin, not doxycycline. It's vancomycin, which has been prescribed to your pharmacy. Because we're talking that you will be going home.
Mm-hmm.
But if you're staying, then I would have to change it and order it here.
And then it would come in what form, ma'am?
A pill form.
A
as
pill
it would
form?
be at home. Yes.
Okay.
But that is, yes.
Mm.
Devin, have you been getting?
And so it would be a capsule formation, not infusion doxycycline, a liquid formation?
It's called vancomycin, not doxycycline. It's vancomycin, and it's to treat a C. diff. It has to be a pill form to go into your stomach, your gut, your colon, so that it can be effective. IV vancomycin does not treat C. diff.
That makes sense.
I'm so sorry. Could you repeat that one more time?
What treats C. diff is vancomycin, and it's pill form in capsule. That is the guideline use for vancomycin pill to treat C. diff.
So the capsules that I was prescribed should treat my C. diff?
Yes.
Okay, and then you're also saying that you could order a doxycycline here for me, for which would also treat my C. diff?
Did not say I ordered doxycycline.
I'm so sorry,
I said-
vancomycin. I keep calling it doxycycline because I thought that it used to be under the heading of doxycycline. That was my mistake. Okay, so let me rephrase and repeat. So the medication that I was prescribed that is literally waiting for me to pick up will treat my C. diff, and it is called vancomycin.
Yes.
And then what I also heard is that there is a vancomycin that you could prescribe here for me that would also treat my C. diff.
It's the same thing. It's just going to be in hospitals if you're staying.
And you're saying it's the same thing?
As the one that was prescribed to you to the outside pharmacy.
Okay, so it's the same thing.
Yes.
Okay. Now, my next point is why then can I not get infusion vancomycin?
Because
From
it's got to go in the
guidelines from
gut.
CDC, the treatment for C. diff, which is a bacteria in the gut, is to use a pill form of vancomycin.
I'm so sorry. My
IV
mom
does
keeps
not treat it.
interrupting and I'm losing completely focusing on this conversation. Mom, can you please not do that?
All right.
Okay, ma'am, can you please repeat that? Why can I not request infusion vancomycin?
Because vancomycin through the IV does not treat C. diff.
Is there another reason for which I cannot swap that out or switch it with infusion vancomycin?
Because it will not treat C. diff.
Do you happen to know if infusion vancomycin brings down the WBC or not?
If you have a proven bacterial infection, it will help with the infection, but it does not mean it will bring down the CBC.
Okay.
The WBC.
My next point of fact is I was recently admitted at a particular hospital for which I was given infusion liquid vancomycin that brought down my WBC, and this is highly documented. I asked for copies, printouts that I got handed to me because I requested them and because I am very assertive and because I know literally what to ask for regarding my chronic myelogenous leukemia diagnoses. Did you happen to know that vancomycin infusion liquid antibiotic treatment such as liquid vancomycin brings down the WBC dramatically to around, I'd say, below 20?
Hope you know that vancomycin is an antibiotic that treats infections. If your white blood cells is elevated because of the infections, it will help. But with your white blood cells of 190s to 170s is not infection itself. And you yourself does not have any symptoms of infection, such as a fever, such as a blood culture that's showing you have an infection.
Yes, I do
So
have an
how can I
infection.
treat-
However, what literally washes it out is utilizing a therapeutic supplement approach of niacin, L-lysine, ascorbic acid, and lecithin made into a hot tea to be able to trip up the medical professionals. So, wherein which it's like a type of secret shopper amongst you. And literally, ma'am, I do have a need for I'm so sorry, I was going to call it doxycycline again. I do have a need for the vancomycin, which I thought it used to be under the heading of doxycycline. But anyways, I do have a need for vancomycin. However, I have been tripping all of the medical professionals to be able to catch medical professionals in lies, basically, to catch the medical professionals in lies. And so what with said such various visitations that I have had within several years that I've been experiencing my particular chronic myelogenous leukemia diagnoses, I am going to state again that liquid infusion vancomycin does bring down the WBC. However, I was only admitted for, say, about 3 days when the number was, say, around 30 or 40, or I would have to quote my paperwork that I have with me, but it was brought down to 20. And literally, what was getting in the way of that is I happened to bring food with me that had contact contamination in it. And so I was literally eating from said such foods that brought up the WBC while the liquid infusion vancomycin was bringing down the WBC.
What would you like me to do? I do not know where this conversation is going.
I believe this conversation has been informative for us both, and I would still like to receive the vancomycin as well, and I would like it to not be taken back or discontinued, please.
No, I don't plan, and it has not been discontinued. It's at your pharmacy.
Okay.
Do you want to stay and get that hydroxia to bring down your white blood count?
I already know how to utilize that, Mom.
So you do not want to stay?
I'm kind of in the middle of trying to talk.
All right. All right. I'm going to go to the bathroom. I'll be
Right.
right back.
Heaven's sakes. What I believe I'm going to do is I'm going to pick up the vancomycin in general and literally take that for the C. difficile.
Okay. I'll respect that.
All right. And is there any way that I could otherwise literally receive liquid infusion vancomycin from your establishment?
If you want, I can draw blood culture to see if you have bacterial infections. I don't think there's no. There are guidelines against using it if there's no infection.
Well, and you weren't able to literally see the fact that I was taking antibiotics at all?
Well, unless I check the antibiotic level, there's no way that you can check someone's having antibiotic unless you check a level of it.
I feel like I'm caught in between a rock and a hard place. Okay, so, Well, I am literally going to repeat the fact that the various products at the health food store that can clean out the blood work so much so to where you can literally force reflecting numbers that you want is something that's true and something that's available and something that is real and has been available at health food stores for decades now. It's detox teas, niacin, L-lysine, ascorbic acid, and lecithin made into a literal hot tea to be able to flush out various said such drugs to hide the fact that various medications have been taken. And it's drugs and medications, but I literally put it under the heading of drugs in general. So the next step would be accepting a type of culture given through, what would it be, urine or blood?
Most of the time for vancomycin, we have a blood infection. So it will be blood culture that needs to be drawn.
Okay. So giving yet more blood.
Drawing blood cultures to check to see if you have infection in your blood. Yeah.
All right. And when could I get this done?
So we can draw it. It will take about at least 24 to 48 hours to come back. And then when they come back and it's positive, then we can start vancomycin if it's positive, yes.
Okay. Could we go ahead with that?
So you're staying, we draw a blood culture. Is that what you're trying to tell me?
Yes, as long as it's one of the liquid infusion vancomycins, because it'll help get rid of a lot of the inflammation weight specifically, which is what happened at my previous hospital admitted stay. And I literally dropped so much weight just from the liquid vancomycin.
Okay. So oh, okay. So you staying today?
Yes.
Okay. I'll let my doctor know.
All right.
And we can order the bacterial infections workup, and also you want me to order and check for your herpes too?
Yes, please, ma'am.
Okay. I'll let my doctor know, and I shall let you guys know what's the conclusion. Okay?
Okay, and I appreciate, thank you for talking to me. You seem highly educated, and I really appreciate it. It's hard to find.
You're welcome. I'll communicate with your nurse, or I'll call your mom back, or call your room to let you know what's the game plan. Okay?
Okay,
All right. Thank you.
thank you.
Bye bye.
Bye.